My name's Elise. I'm going to demonstrate to you bed mobility. This technique occurs in two phases. First, we will move the patient from a supine position to lying on their side. Then we will move from side lying to sitting on the edge of the bed. I have Chris here who's going to help demonstrate this.
Hi everybody.
First, you want to ensure that there is enough room to roll the patient onto their side. Chris here has enough room. However, if they don't, you want to move the patient a little bit across the bed. So, in order to do this, we'll get the patient to bend up both their knees, like so, and then push through their heels and their elbows to move across the bed. Excellent, Chris. Then, if the patient isn't already positioned with their legs bent, you want to get them to bend both their legs up, like so. Excellent, Chris. If they need assistance, you can place your hand underneath the patient's foot and underneath their knee and move it up into a bent position like so. Next, you want to get the patient to look towards the direction they're going to and reach their arm across their body. And you can see he's already rolling onto his side. Great work, Chris. If the patient needs assistance to roll onto their side, you can place one hand on their hip and one on their shoulder blade and roll them on the side like so. Excellent, Chris. Once the patient's in side lie, you then move to sitting them up on the edge of the bed. First, you get the patient to move their legs off the side of the bed and then get them to push up with their bottom elbow and their top hand so that they are sitting on the edge of the bed. Well done, Chris. If the patient needs assistance, I'll demonstrate that to you now. So I'll get you back onto your side, Chris. Excellent. So sometimes the patient only needs you just to move their shoulder forward, like so. Often they want to lie back onto their back. So you can do that by moving the shoulder forwards. The other way you can provide assistance is get your legs off the bed for me again, please, Chris. So you can place one hand on the patient's hip and one on their trunk. And then we're going to push down the hip and sit the patient up onto the edge of the bed like so. An alternative approach is using an electric bed. This is a common technique used with orthopedic patients post-surgeries like total hip replacements and total knee replacements. Firstly, you want to sit the patient upright. Okay, then you want to move one leg at a time to the edge of the bed. So give the patient an opportunity to move their leg. Good work, Chris. If you do need to provide assistance, place one hand under their ankle and one under their knee and move the foot towards you slightly, one at a time, until they're on the edge of the bed. Okay, once the feet are on the edge of the bed, you will then need someone to assist you. I have Jess here. I'll get Jess to look after the trunk. She'll place one hand on the patient's shoulder blade and the other hand on his shoulder blade, and she'll be working on moving the patient forwards. I'll be looking after the legs. On the count of 3, Jess and I are going to move the patient in one motion so he's sitting on the edge of the bed. In an orthopedic patient, I will also be supporting the leg to avoid, again, causing pain. So, 1, 2, 3. Great work, Chris. And we'll drop this leg down and push through your hand so your feet are on the ground. And I'm going to slowly lower the leg. A little bit more, Chris. And there we have it. While this is a useful technique to use in the hospital setting, it is important to remember that most patients do not have an electric bed at home. So it is important to encourage getting out from a flat surface and practicing as earliest as possible.